Okay, everybody, I've got the medication stuff that we were going to go through today. I hope everybody has been safe, that you're staying plenty warm. So this is just going to be some of the medication tips, and then I will go through the worksheet as far as the med calculation. I'm going to apologize in advance. My kiddos also have a snow day today, so if they come in and disrupt us at any point, I apologize. So with some of the medication tips, be sure that you know the 6 rights of the medication administration. So this is important as far as patient safety. So we need to always confirm these prior to giving those medications. So we need to make sure that we have the right patient, the right medication, the right dose, the right time, the right route, and then of course the right documentation. So that especially like if it's IV, IM, where did we give those medications, all of that. Be sure that all of that is verified and in your chart prior to giving any medication. A lot of the fail-safe stops in our EMR systems will help with that. So 2, be sure that whenever we are going through the med calculations on any exams, things like that, that we're using our rounding rule, really pay attention to that, whether it's asking for that 10th place, that 100th place, or if it's asking you to round up to the whole number, especially with hours that we'll see in the med calculation sheet. So be sure to not round any numbers until the end of the problem, especially with weight conversions. This is especially important in your pediatric medication. So example down here is going to be converting those pounds to kilograms. We can see that that measurement is going to be that 34.54. So then we can go ahead and take that up 34.6. I usually like to keep it at that decimal, especially when we're dealing with like micrograms and things like that. So be sure to pay attention to what the question is asking you for. Again, make sure that we don't have any trailing zeros. So, correct would be 5, incorrect would be 5.0. If they mistake that, that could be read as 50. So be sure that we're not doing that. We also don't leave any naked zeros. So the correct way to write any decimal is going to be that 0 point whatever number. So like here, we're going to see that 0.17. The incorrect way of doing that is going to be the 0.17. Again, that can be misread as 17 if they don't pick up that decimal. That's why we put that 0 in front so that they know that this is not a whole number that we're dealing with. And then be sure to round to the nearest 10th on those. So for the med calculations that we're going to go through, some of the fluid equivalents, these are especially important for you guys to have memorized at this point. In Adult Health 1, you guys may have started seeing some conversions. In Adult Health 2, for our clinicals, you're going to start seeing a lot of these. So be sure that you know these. If you don't, have a cheat sheet card that you can take with clinical to clinical so that you guys can read through those. So 1 gram is going to be that 1,000 micrograms. 1 milligram or 1 gram is 1,000 milligrams. 1 milligram is 1,000 micrograms. So a cc and an ml are exactly the same thing. Whenever you're seeing that, a lot of times we will see that with insulin stuff. But remember, 1 cc is equivalent to 1 mil. 1 liter is going to be 1,000 milliliters. A teaspoon is 5 mLs. 1 tablespoon is 15 mLs. 1 tablespoon is 3 teaspoons. So be sure with some of these pediatric conversions that you guys are going to see in your peds course, you're going to see a lot of this tablespoon, teaspoon, 2 mils. So make sure that you guys know those as well. 1 ounce is going to be 30 mils. There's 8 ounces in 1 cup, which means 1 cup is equal to 240 mLs. So if you can't remember that, just remember that there are 8 ounces in 1 cup, but there's 30 mils in 1 ounce. So you can convert that out. So 8 times 30 is going to be 240 mils. 1 kilogram, that's going to be 2.2 pounds. You guys should know that off the top of your head. We do lots of conversions in pediatrics, as well as adult health. Sometimes you will have those pounds to kilos. We usually always deal in kilos. And then 1 kilogram is going to be 1,000 grams. So again, make sure if you are giving a dose that you pay attention to how many times a day this will be given. So if it's Q24 hours, you're going to have to see, break that down into whatever the EMR system is telling you, whether it's twice a day, once a day, if it's 3 times a day, 4 times a day, make sure that you pay attention to the how many times a day in 24 hours. If you have a dose that it is dependent on the weight, you need to take that dose and multiply it by the weight and then divide it by however many times it is given. So for instance, if it is, so many milligrams in 24 hours, but we're giving it every 8 hours, you're going to take however many milligrams and divide it by the 3 times a day, which is the 8 hours. And you'll see that whenever we get into the med calculations next. Make sure that you know that medications require a double check from a licensed nurse. So insulins, narcotics, anything that we waste. So the universal formula for this is going to be that desired amount. The amount on hand times the quantity is going to be the dose that we have. So that's going to be the formula that we're going to use. So if you need to find the weight first, do that and then the desired amount. So as on this tip sheet, if the dose is 20 mg per kilogram and the weight is 100 pounds and the nurse has 200 milligrams per 10 mLs, the amount to be administered, you're going to find that weight first. So again, 100 pounds divided by that 2.2 pounds in 1 kilo is going to give you 45.5 kilos. And then you're going to go on to, we're giving 20 milligrams per kilogram. So then we have to take that 45.5 kilograms that we just found, multiply that by 20, which gives us that 910 milligrams. Then we're going to take it a step further and we're going to take that 910 milligrams, so the ordered dose that we just found, divided by what we have on hand, which is going to be that 200 milligrams times 10 mLs. So very, very important that you guys know how to do these steps and follow through. I will walk you through the med calculation sheet. All of that is going to be on the bottom. With body surface area, we were discussing this. This is not something that we're necessarily going to have you guys do. This is kind of an outdated practice for body surface area. With peds and adults, a lot of times we're just going to deal with those kilograms. And then also we're going to need to know how to figure those drops per mil. So remember, with drops per mil, or the drops per minute, that's going to be GTT per minute. So anytime we're trying to figure out how many drops per minute, start out with that so that whenever you start making your conversions, that you know exactly where you're at. So if a tubing has 20 drops per mil and the order is we're giving 1,000 mils over 8 hours, so then we're going to take that 20 drops per 1 ml, multiply that by the 1,000 mLs over 8 hours. There is then 60 minutes in 1 hour, which gives you 20,000 divided by 480. So if you take all of those top numbers on those fractions and then all of the bottom numbers, that gives you 20,000 over 480. That is equal to 41.66. Again, remember rounding rule. We cannot use decimals when we're figuring drops per minute. So that's going to bring us out to, we're going to round that up to 42 drops per minute. Pumps do not allow fractions or decimals when we're dealing with drops per minute. And then again, know how to calculate the mils per hour if you're given units per hour. Do not forget this conversion. If you guys forget what you're looking for, be sure to highlight or circle that in the question and look at what they're giving you. So for instance, we have 1,000 units per hour and 10,000 units per 500 mil bag. So then we're going to take that 500 mils over the 10,000 units and then multiply that 10,000 units per 1 hour. That's going to give us 50 mils per hour. Okay, so now we're going to work on some of these dosage calculations here. So let's get this blown up. So this goes into our conversion side of it. So we've got 1.5 grams. We know that 1,000 milligrams is equal to 1 gram. So with that being said, 1.5 grams is going to be equal to 1,500 milligrams here. On the next one, we've got 200 pounds. Go to that conversion side. We've got 1 kilogram. Is 2.2 pounds. So we're going to take 200, which is the pounds, divided by 2.2 pounds per kilogram. That gives us 90.9. At this point, I leave it right there, guys. If we need to do any rounding, we can do that at the end of the problem. Don't round this up to 91, especially in peds, you know, because too, at that point, you could be slightly overdosing those patients. So on C, we've got 10 ounces. We're looking for how many mils. So 1 ounce is equal to 30 mils. So we're going to take that 10 ounces that it's asking for, multiplied by 30, and that's going to give us 300 mLs. On the next one, we've got 0.1 milligrams. And we know that 1 milligram is equal to 1,000 micrograms. So if we take that 0.1 milligrams, multiply that by 1,000 micrograms, that is going to, over 1 milligram, that's going to give us 100 micrograms. Here's another one of those conversions. We've got 2 cups. We want to know how many mLs we've got there. So 1 cup is equal to 240 mils. We're going to multiply that by 2 because we're looking for 2 cups. That gives us 480 mils. So we're going to roll right into these orders. So we've got Coumadin, 15 milligrams PO is ordered. They want to know how many tablets we're going to give. So we have to go into our order, look at what our order says. So this order is, they are 5 milligram tablets. We want 15 milligrams. So 1 tab is 5 milligrams. So 15 milligrams is going to be 3 tabs. So in order to check your math, you're going to roll into that 3 tablets times, there's 5 milligrams per 1 tablet. That's going to give us the ordered dose of 15 milligrams. So our answer of 3 tablets, that is going to be correct. So the next order is going to be diflucan, 100 milligrams PO daily. How many mLs are we going to give this patient? Again, we need to look and see what our order says. So the order tells us right here that we have 40 milligrams per ml. So our ordered dose is going to go up front. We've got 100 milligrams. We're going to start this fraction out. So in order to make this work, we've got 1 ml. That's what we're looking for. So that needs to be a top number over 40 milligrams. So we're going to take that 100 divided by 40 gives us 2.5 mLs. This will be our answer right here. In order to back check your math, you're going to take the answer that we just got, that 2.5 mils, and we're going to plug it back into the dose on hand. So we have 40 milligrams per 1 ml. Your ml here, your ml here cancel out, leaving you the more milligrams. So if you take 2.5 times 40, that gives us the 100 milligrams, which matches our ordered dose up here. I find this especially helpful to go back and check my math. I've gotten better at math as I've gotten into my profession. I was not good at math starting out. So I always like to go back, check my answer, make sure that by plugging in my answer into the ordered dose, that we're able to match those numbers up there. If it is something that doesn't help you, you don't feel like you're far enough along, then just disregard how I'm checking it and then just move on to the next question. Okay, so on this one, we are given fragment 5,000 units is what is going to be given. And how many mLs are we going to give this patient? So we have to slide down, sorry, that's split on 2 pages here. So we have to slide down, we have to look and see what is available. So our availability on hand is 10,000 units per mil. So our ordered dose, 5,000 units, is going to go out front here times 1 ml is going to be equal to 10,000 units, which is equal to that 0.5 ml. So we're going to be giving 0.5 mLs to this patient. So in order to check our math, because again, this is what you have available. This should be an over to start that fraction, sorry. So to check our math, so the answer that we just got, so that 0.5 mLs, we're going to plug that back into what we have on hand, which is going to be that 10,000 units per 1 ml. We're looking for how much is ordered here. So then with that, when we figure this conversion out, 0.5 times 10,000, that gives us 5,000 units. So that answer that we got, that 0.5 here plugged back in, gives us the ordered amount, which means that this 0.5 is the correct answer. All right, Narcan or naloxone. So we're going to give 0.3 milligrams IV stat for respiratory depression. How many mLs will we draw up in the syringe? So we're going to take the ordered dose, 0.3 milligrams, times what we have on hand. We have 1 ml over 0.4 milligrams. That's what's available. That's going to give us 0.75 mLs. Now, this is your answer that you are looking for, not to get confused. I am just checking the math here. So if we take the answer we just got, 0.75 mLs, and multiply that back by what we have on hand, 0.4 milligrams per 1 ml. Your ml on top here cancels out your ml on bottom. So with that, we get 0.3 milligrams. That matches our ordered dose, confirming that 0.75 is the correct answer. Number 6. So potassium chloride, 20 milliequivalents is ordered to be added to an IV solution. How many mLs will we draw up? So our ordered dose goes up front, that 20 MEQs here. We're going to multiply that by what we have available. So we have 1 ml is 2 milliequivalents. I'm seeing that right here. Disregard this number. That is just to throw you off. That's just telling you how much is in the bottle. So 1 ml over 2 milliequivalents, that is what we've got. So we're going to take that. We're going to take 20 divided by 2. That gives us 10 mLs. That is your answer. In order to check your math, you're going to plug that back in. You're going to take that 10 mLs that we just found, multiply it by what we have on hand, that 2 MEQs per 1 ml. That gives us our ordered dose of 20. That just helps us confirm that that 10 mLs is the correct amount that we're giving. Now, what happens if we plug this back in? This answer does not match this answer, then that means that whatever you put here is not correct. So make sure that if you are double checking yourself that these numbers match up. If they do not, then whatever answer you got on this line here is not correct. All right, so with this, we're going to mark the syringes below to indicate the stated amount. So regular insulin 7 units plus NPH insulin of 24 units is ordered at 7:30. Indicate the dosage you would draw up first, then combine dose on the syringe. Okay, so remember from Adult Health 1 when we were doing our insulin. So we're going to draw up clear, then cloudy, because if we draw up cloudy, we're going to contaminate that clear bottle. So we're going to draw up this regular insulin first. So we've got the 7 units marked down here. Then we will draw up the NPH insulin, which is cloudy. So we're going to draw up our 7, and then we're going to draw up our 24. So whenever we draw that up, we should have 31 units total. 24 plus 7 is going to be 31. So make sure that whatever you have, that matches. Again, insulin is one of those error medications, so we have to confirm that with another nurse. All right, and I couldn't get these to copy over quite correctly. So indicate 4.2 mLs by drawing an arrow on the syringe. Each line on this one is going to be 2 mils. So 2, 4, 6, 8, 10. So 4.2 is going to be to that 4 and then that next little tick line there. Indicate 2.7 mils by drawing an arrow on the syringe. So on this syringe, each line is 1 ml. So you've got your 2 here. So this is 2.5. You're going to go 2.6, 2.7 would be the correct amount to draw up. And then on this last one here, indicate 0.33 mLs by drawing an arrow on the syringe. So each line on this syringe is going to be 0.1. Again, here's where we're seeing this. 1 cc is equivalent to 1 ml. So on this one, with each line being 0.1, we go to the 0.3 and then we add 1, 2, 3. That will give you the 0.33. All right, so number 8 on here, guys, is going to be the Kefzol. So it's 125 milligrams IM is what we have ordered. How many mils will we draw up to administer? We need to pay close attention to the dilution. So this is going to be with the dilution, which if you read over here, is 250 milligrams per 2 mils. So we're adding 2 mils of solution into this. So then we break that down. This gives us 125 milligrams per 1 ml. So if you take 250 divided by 2, that's how we got that 125 per 1 ml. Now, we are going to plug this in to make sure that everything matches up. So we've got ordered is 125. So we put the 125 milligram order up front. We are going to multiply that by 200 or 2 mLs over 250 milligrams. So when we figure that out, that gives us 1 ml. So in order to check our math, we're going to put 1 ml times what we have on hand, that 250 milligrams per 2 mLs. That gives us that 125 milligram order, which confirms that this 1 ml that we selected, that is the correct answer. On number 9, oxacillin, 500 milligrams IV is ordered. How many mils will we draw up? So then we're going to put that 500 up front, 500 milligrams up front. We're going to multiply that by what we have available. So look within this print. This print tells us that 1.5 mLs is equivalent to 250 milligrams. So 500 times what we have available, 1.5 mLs divided by the 250 milligrams, that gives us 3 mLs. Again, to check ourselves, if you like this method, if you do not, then just stick with that 3 mLs. To check our math, we're going to take our answer, that 3 mLs, and multiply it by that 250 milligrams divided by 1.5. That's going to give us that 500 milligram ordered dose up here, which helps us to confirm that 3 mLs is the amount that we are giving. All right, so infusion rates. I know several of you last semester got kind of tripped up on the infusion rates. So again, this is where I'm talking about highlighting. Make sure that you highlight, underline, whatever you need to do. What are we looking for in this problem? That is what we need to know. So we have 1,000 mLs of IV fluids to infuse over 8 hours. So the amount ordered is 1,000 mils over the duration, 8 hours. That gives us 125 mLs per hour. Again, how do we check ourselves on this? We take our answer that we just got, we drop it back into the hours of infusion. So we take 125 mils, multiply that by the 8 hours. The hours here cancel out. That gives us our 1,000 ml order. That means that the 125 mils per hour is the correct answer. Whatever you need to do, highlight, mark up, write it on the top of your whiteboards. What are you looking for? Because at the end of our conversions, you should be able to knock everything else out except for what you're looking for. You guys will see how especially important that's going to be as we continue to progress through these problems. Number 11. So 1,000 mils of IV fluid is to infuse over 12 hours. Calculate the flow rate in GTT per minute, drops per minute, using the micro drop tubing that gives us 60 drops per ml. Okay, so this is adding way more steps. You guys can see where canceling things out is especially important. So we take our initial order, that goes up front. We've got our 1,000 mils over 12 hours. So we're trying to get to this, the drops per minute. So we're going to take the next step will be to cancel out our hours so that then we're in minutes. So we're in the correct time. So we've got hours here. So we know that 1 hour is equivalent to 60 minutes. Our hour on top here cancels out our hour on bottom here, which leaves us 60 minutes. Now we're going to multiply that by the tubing rate that they provided us. That's where this 60 GTT per mil comes in. So now this is how we get that drip rate or that flow rate. So we've got 60 GTT per mil that then we're going to plug into the backside. So when we mark everything out, we should have mLs will cancel out mLs. So this is on top, this is on bottom. mLs cancel out here, hours cancel out here. So that leaves us with our 60 drips per minute. So write this out on your paper. Make sure that you're crossing everything out. So when we start doing that math across the top, We should get 60,000 as our top number, 720 as our bottom number. When we do that math, that gives us 83 drops per minute. That is your answer right there. So again, make sure that whenever you guys are crossing out for these conversions, highlight or write up at the top of the board what you're looking for. And this, what it's asking for in the question and what you get at in their answer should match. On number 12, so we've got 100 mils is to infuse over 45 minutes via a pump. What will we set the pump at in mils per hour? So it's giving us minutes. So again, highlight this. This is what we're looking for, mLs per hour. We're going to take that order, 100 mils over 45 minutes. Now we're going to multiply that out. So we want mils per hour. So mils is on top. So we need to make sure our hours is on bottom. So we take that 100 mils over 45 minutes. Now to convert it to hours, we know that there's 60 minutes in 1 hour. We multiply that across. That gives us 6,000 divided by 45. 133 mLs per hour is our answer. Now, the next one, we are going to have 1,000 mils of IV fluid infusing at 25 drops per minute using 15 drops per mil tubing. What is the infusion time or duration of this bag of IV fluids? Round to the nearest hour. So we've got 1,000 mils. We're not giving anything else. So that is just automatically over 1, 1,000 mils over 1. We're going to multiply that to get rid of our mils, because remember, we're looking for infusion times in hours. So that nearest hour is what we're looking for here. So highlight that, make sure we know what we're looking for. We take that 15 drops per 1 ml, which is given to us up here. That is the tubing rate. And then we're going to take what the infusion rate is. So we've got 1 minute over 25 drops. Now we're going to go take that a step further, because again, this is giving us minutes. We need hours. So 1 hour over 60 minutes. Go back through, cancel everything out. Your mLs here, cancel out your mLs on bottom here. Your drops on top here, cancel out your drops on bottom there. We're left with 1 hour, your 60 minutes on bottom, cancels out your 60 minutes on top here. Multiply that out. We've got 15,000 divided by 1,500. That gives us 10 hours. 10 hours is going to be the correct answer. Now on to number 14. An IV of 1,000 mils is infusing at 50 drops per minute using IV tubing that is calibrated at 20 drops per mil. So this is very similar to the one that we just did. But pay attention, finish reading the question. If the IV was started at 8 a.m., when will it be completed? So this is asking for military time. So finish reading it out. Don't assume that you know what it's asking for. Round to the nearest hour and give the answer in military time. That is all that you guys will see in clinical. I'm sure most of you saw it last semester. You will see it again this semester. You will only use the 24-hour or the 2,400-hour timing for military time. So to break into this problem, we've got our ordered amount, 1,000 mils. We are going to take that at that tubing calibration rate. So that 20 drops per mil, your mils on bottom here will cancel out your mils up there. Now we're going to take that, multiply it by the time. What is it infusing at currently? We are doing 1 minute over 50 drops. So your drops on bottom here cancel out your drops on top there. Multiply this out by 1 hour over 60 minutes. That gives us the hours that we're looking for. So your minutes cancel out, minutes cancel out. So when you figure this, when you work this across, you've got 20,000 divided by 3,000. That is going to give us 6.7 hours. It is saying round to the nearest hour. So this is greater than 0.5. We're going to go up to 7 hours. So this infusion started at 0800 hours. We are going to add 7 hours. So it should finish at 1,500 hours, which is 3 p.m. All right, so number 15, this is one of those that we're gonna have to convert prior to starting the problem. So the MD orders 80 units per kilogram of heparin to be given stat. How many mLs will we draw up and administer in the ordered dose? The patient weighs 188 pounds. So first of all, this doesn't have pounds, we have to get it to kilograms. So to convert that weight, we've got to take that 188 pounds divided by 2.2. That gives us that 85.45 kilograms. Now we can start working in on the problem. So the ordered dose is 80 units per kilogram. So we come down here, we write 80 units per kilogram. Now we're going to multiply that out by the answer we just got for weight, which is that 85.45 kilograms. Your kilograms on bottom here, or on top here, cancel out the ones on bottom here. That gives us the units that we're looking for. So the ordered dose for this patient is 6,836 units ordered. We are not done yet because it is asking us how many mLs will we draw up to administer. So this is where we now have to look into what we have on hand. We put the ordered amount up front, that's 6,836 units, and we are going to multiply that by what is on hand. We are looking for mLs. Your mLs should be on top. So on hand, we have 1 ml is equivalent to 10,000 units. So this is going to work out to be 0.68 mils. So you're going to take that 6,836 divided by the 10,000 units. That's going to give you that 0.68 mils. Now, down here, this is how I checked my math. Is you take that answer we just got, the 0.68, to make sure that that is the correct answer. We plug that back into what we have on hand. We have 0.68 mLs times 10,000 units over the 1 ml, over 1 ml. So mLs cancel out, leaving us with units. That gives us that ordered dose of 6,836 units. This matches this up here that we figured, which means that that is the correct dosing for this patient, 0.68 mils. Again, if checking your math is way beyond where you're at this point, then just ignore all of those steps. But this is how we are going to show you guys how to work these. Okay, so this one is a little bit more involved here. Let me scroll down just a little bit more so you can see this order. So the provider is ordering 125 milligrams of amoxicillin every 8 hours for a patient that weighs 58 pounds. We need to calculate the daily dosage range recommended on the label and compare the daily dose ordered by the doctor. Now, that is what we have to figure out. Does the provider order fall within the usual dosage range? So the first thing we need to do at this point is figure out our weight. They gave us 58 pounds. Again, we do not deal with pounds, we deal with kilograms. So you take 58 pounds divided by 2.2. That is going to give you that 26.36 kilograms. When we scroll down here, we are then going to plug that into what the ordered dose is. So children, it says 20 to 40 mg per kg a day in divided doses. So if we take that 20 range, 20 mg per kg, multiply it by the kilograms that we got, that gives us 527 milligrams. Then we take that 40 recommended dose on the high end, that gives us the 1,054 milligrams. We go up here, now we figure out what is our ordered dose. So they ordered 120 milligrams per 5 mils, which is what is on here, every 8 hours. So we're going to take that 125 times 3, because there's 3, that would be 3 times in a day. That gives us 375. So on this patient, the correct answer is going to be that that dosing is too low as ordered. As ordered dose is 375 milligrams per every 24 hours, but the recommended range is 527 milligrams to 1,054 milligrams every 24 hours. So this is lower than what the recommended numbers are that we've received here. So we plug that in, that will be your answer. Number 17. So Aggrastat is ordered to infuse at 0.1 micrograms per kilogram per minute for a patient weighing 136 pounds. We have a pre-mixed IV bag that contains 12.5 milligrams per 250 mils. How many mLs will you set the IV pump at? Okay, so we have to break this down into several different components. So make sure that you are doing all of the correct conversions to get this ordered dose to what it is asking for. First step we need to do is to figure out the weight. So we have 136 pounds divided by that 2.2 kilograms. So when we get that, that's going to give us 61.8 kilograms. That is what the patient's weight is. Now, we have to plug this in to figure out what our ordered dose is. Here is what it's asking for. We have to figure out what the dosing is. So we are going to take this 61.8 kilograms and multiply this out to 0.1 micrograms. That is going to give us 6.18 per micrograms per minute is what we are dealing with here. So we've got 6.18. We're going to drop this into our equation now. We have 6.18 micrograms per minute, and we are going to multiply that out. So we need mLs per hour. So we know that with what is given, we have 12.5 per 250, that 1 milligram is equal to 1,000 micrograms. That is going to get your micrograms to cancel out. Now we're going to take this another step further. You can either do this beforehand like I did to have ready to plug in, or you can do the math now. So we're going to figure out how many milligrams there are per mil. You could also just plug the 12.5 divided by 250 in. I do it out here to make sure that I can just plug it in. So we're going to take what we have on hand, that 12.5 milligrams per 250 mils. That gives us that 0.05 milligrams per mil. We are going to plug this back into our equation. So this is going to help us to cancel out the milligrams. So we have milligrams canceled here, milligrams canceled here. So now we're left with minutes. We don't want minutes, we want hours. So we've got the mLs on top like we need. Now we need the hours. So we're going to come back in over here to get that conversion. Minutes is on bottom. We're going to put 60 minutes on top over 1 hour. That helps us to line up. We've got our mLs here, our hours on bottom here. When we work this math across, we should have 370.8 divided by 50. That gives us 7.4 mLs per hour. Again, this just says how many mils per hour will you set that at? We usually cannot set decimal places for mils on hour. So we're going to round to that nearest hour, 7 mLs per hour. Again, be sure to ask for the med exam what exactly, if there's any question on what they are looking for and what your rounding rule is. All right, so number 18. 18, a patient is receiving amniophylline IV at 20 mils per hour. The IV contains 2 grams of amniophylline and 250 mils of IV fluid. How many milligrams per hour is the patient receiving? So we're going to highlight this right here. Milligrams per hour is what we're looking for. So we take what we have. We've got 2 grams right here over 250 mils. We know that there is 1,000 milligrams over 1 gram, because we've got to get rid of the grams here because we're looking for milligrams per hour. So grams on the bottom cancel out grams on the top here. And then we're going to throw in what the current infusion rate is. So 20 mils per hour. So our mils on bottom cancel out our mils on top here. That is going to leave us with milligrams per hour when you guys write your conversion tables out. When you work this across, this gives you 40,000 divided by 250. When you work that out, that gives you 160 mLs per hour. Or sorry, milligrams per hour. And then on number 19 here, Ativan 4 milligrams IV push is ordered for sedation. The drug reference says to dilute the drug immediately before use with the equal volume of diluent. Inject slowly at 2 milligrams per minute. So we have 4 milligrams per 2 mils because we're diluting it out, 4 milligrams per ml. So when we come back in here, our ordered dose is 4 milligrams times that 2 milligrams per 4 milligram on hand. We are going to give 2 mils of this medication. We're going to break down into the next step of this. It says, so now we know we have 2 mils and give the med over how many minutes. So we know that we are supposed to give this medication at 2 milligrams per minute. We have a 4 milligram ordered dose and that we are giving 2 milligrams per 1 minute. So we are going to give this medication over 2 minutes at a rate of how many mLs per minute. So we have 2 mLs divided by 2 minutes. That gives us the rate of 1 ml per minute. You're going to plug that in. So to administer this medication, the nurse will go to the room with a syringe containing 2 mils and give the med over 2 minutes at a rate of 1 ml per minute. Let me scroll down here, guys. Yeah. Okay, so I double checked this one here. So the answers are at the bottom of your sheet. I just mislabeled that when I was working through, but 160 milligrams per hour. Now to go to number 20. So we have a lidocaine 100 milligram IV bolus is ordered for cardiac dysrhythmia. The drug is available at 20 milligrams per mil. The drug reference says to administer the medication at 50 milligrams per minute. So to administer the medication, the nurse will go to the room with a syringe containing X amount of mils. We're going to take our ordered dose, that 100, put it on top here, put it out front. We're going to multiply that by what we have on hand. We have 20 milligrams per mil on hand, so we plug that in. Milligrams on bottom cancel out milligrams on top, leaving us with 1 ml. So 100 milligrams divided by 20 milligrams, that's going to give us 5 mLs. That plugs in here. And we're going to give the med over how many minutes? So this tells us that we need to give 50 milligrams per minute. If we have 100 milligrams ordered, the drug reference guide says we're going to give this at over 1 minute for 50 milligrams. Our ordered dose is 100. That's going to give us 2 minutes. So, okay.